Okay, chapter 18. Let's keep moving. Upper respiratory disorders. We're going to be doing the greatest hits again. We have antitussives, opioids, codeine, hydrocodone. Now remember, these type of drugs can be antitussives. Remember, antitussive makes you not cough. But also there's your CNS defects because this is also pain medicine, right? So we're going to make sure that we're not making them too drowsy or making them dependent on the drug. So keep that in mind as you go forward, and we're going to use it cautiously with older adults and children due to the sedative effect. Non-opioid antitussives, um, diphenhydramine is multiple drug, remember your antihistamine, but also I want to use what the main one is dextromorphan, which is found in combination, but dextromorphan is the one we use mostly. We'll talk about diphenhydramine later. Remember that these drugs may contain alcohol or sucrose, depending on if you have somebody who has issues with those things, hyperglycemia or whatever. So keep in mind that we want to make sure that the outcome would be decreasing coughing. Now, the next class is expectorant. Expectorant is the guaifenesin, Mucinex, and what we want to do is have increased cough production, and we want to increase secretion. That's the ones we want it to cough it out, right? Now, the thing that patients need to know is when you're going to the pharmacy and you have your antitussive and your expectorant, which one is your body supposed to do? You're supposed to stop coughing, or are you supposed to cough and expectorate it out? Remember, expectorate, spit it out. And so you really want to make sure that we're treating what the patient needs. And some of those combination drugs that you can buy over the counter are full of a lot of stuff that our patients don't really need. So the expectorant, we're making sure that we get it. They can expectorate it out. So read very carefully is what your book says to make sure that your medication has exactly what you need when you're buying over the counter. Next one is mucolytic. Remember, lytic means to break up. So a mucolytic, acetylcysteine, mucomist, is there, and that's going to help get the secretions gone. So mucolytics we see a lot with cystic fibrosis, but COPD is also there as well. You're going to monitor for signs of aspiration and bronchospasm. Pretty good. Oh, yes. Nursing administration. This drug smells awful. When it says it smells like rotten eggs, if you haven't smelled a rotten egg, boy, it's really horrible. So just keep that in mind that the medication does smell awful. And so take a look at that on page 225. A decongestant. Ephedrine, phenylephrine, ephedrine are there. The allergic rhinitis, nasal stuffiness, that sort of thing. A lot of people have that right now. You shouldn't use it long term. It can have CNS stimulation. Remember that some of these drugs in this category are controlled substances so that people can't make meth. And so that's something that we keep in mind as well. Make sure that you read on page 227 nasal drops and instruction about nasal drops if you're using these nasally. Antihistamines. And so here I told you we're going to talk about diphenhydramine. Now, diphenhydramine is a drug that you need to know because not only are we using it for allergic rhinitis and things like that, but we're also using diphenhydramine for allergic reactions secondary to blood administration or anything where we need to decrease that histamine. In addition, here's another use of it. Diphenhydramine is a sleep aid, right? Because people become drowsy. So keep in mind that this is a drug that's being used for a lot of different things out in the world, and you need to know which one it's being used for. One of the greatest stories that I love to tell in pharma is somebody wanted to have a sleep aid that was more natural, and so they found this pill bottle. I don't remember the name of what the company called it, but it was really diphenhydramine, but it was $10 for 25 pills, and when I looked at the ingredients, it was the same as Benadryl, which was $4 for 100 or whatever it was. And so being a wise consumer and knowing the drugs is important. So the first H2 antagonist is what your diphenhydramine is. Remember that you have your second generation, and that's your Claritin, Zyrtec, Allegra, all that sort of stuff, and that works a little bit differently. And the dry mouth anticholinergic effects are things that we need to be able to teach our patients about. So make sure that we're aware of those things as well. And so that is the end of Chapter 18, and we are going to stop recording so that I don't lose this. See you soon.